With the information presented, it's difficult to ascertain the cause of each warfighter's collapse, but these are scenarios that have been seen in service members with sickle cell trait. As you may recall, red blood cells hemoglobin consists of 4 protein subunits, 2 types of globins, an alpha and a beta, with each type having 2 pairs. All 4 proteins attach to a heme subunit that carries oxygen. A mutation in the beta globin gene can cause hemoglobin S, which presents as sickled-shaped cells. The affected red blood cells can block blood vessels and cause injury to vital internal organs. The presence of hemoglobin S is determined by heredity conditions from both parents. If a parent has 1 copy of the sickle cell gene mutation, he or she is a carrier for sickle cell disease. When 2 copies of the sickle cell gene mutation are inherited, the carrier has sickle cell disease, or SCD. Sickled red blood cells can die prematurely and typically lead to anemia and serious medical complications. The average life expectancy for a sickle cell disease carrier is now mid-40s. Sickle cell disease is a disqualifier for any military service. On the other hand, when only 1 sickle cell gene mutation is inherited, the carrier is diagnosed with the sickle cell trait, or SCT. Sickle cell trait is fairly common and largely benign. Unlike sickle cell disease, complications from sickle cell trait are typically rare, mild, and perhaps avoidable if the person with the sickle cell trait follows basic precautions as well as physician's advice. Since 2000, all U.S. newborns have been screened for sickle cell disease at birth. Yet many adults don't know their status because they haven't been told or can't recall. Upon reporting for basic military training, the Air Force, Navy, and Marines screen recruits for sickle cell status. A recruit identified with the sickle cell trait usually continues training unless their hemoglobin S is found to be equal to or greater than 45% of the total hemoglobin. In this case, the recruit can be separated from training for a condition that is disqualifying, but not a disability. Those who stay in wear medical identifiers so they can be recognized by recruit trainers and healthcare personnel. The exception is the Army, which does not screen recruits, but instead recommends that universal training precautions be applied to all. Following universal training precautions is important for all warfighters' well-being, but may be especially important for those with the sickle cell trait, some of whom may face risks during high-intensity physical training. For some with the sickle cell trait, strenuous exertion coupled with certain environmental and/or physical conditions may increase the risk of exercise collapse associated with sickle trait or exertional collapse associated with sickle cell trait. Clinical presentation of ECAST can vary from severe muscle pain to fulminant collapse. It's important to note that symptoms also may resemble other medical conditions. Many of the effects noted are usually, but not always, seen. Now, back to our real-life warfighters. Questioning revealed the seaman knew he was sickle cell trait positive, which may have in part explained his muscle cramps and failed fitness tests. He was released after rehydration with in-depth counsel and resources, but ignored medical advice and failed to return for follow-up appointments. Unfortunately, he collapsed again during a makeup run, after which he was readmitted to the hospital, where he later died. And though most sudden deaths in the military are unexplained, this seaman recruit may have expired from exercise-related death associated with sickle cell trait, or it could have been a genetic mutation causing an arrhythmia. We're just not certain. The Marine showed symptoms similar to the seaman recruit, but first responders assumed nothing. They began rehydration procedures and then transferred him to a treatment facility. He was successfully treated for exertional rhabdomyolysis. Further investigation into his personal and family history and physical evaluation led to advanced testing, where another condition, malignant hyperthermia susceptibility, was uncovered. This genetic condition, in combination with his fulminant exertional rhabdomyolysis, led to a medical discharge from the service. And though first responders knew that the airman had the sickle cell trait because she was wearing a red medical alert dog tag, Her symptoms were actually related to dehydration and mild heat exhaustion. She returned to service with a commitment to follow the advice of her medical team. These scenarios remind us of the need to be prepared, and you can be if you recognize symptoms of struggling warfighters, no response protocols, fluid and electrolyte management, blood gas and cardiac monitoring, emergent consultation with cardiology and nephrology. Keep abreast of DoD policies and updates, including eligibility for special duty schools, and counsel warfighters about access to screening and resources, the importance of hydration and conditioning, and that the reporting of symptoms to their healthcare providers are critical. Return to duty decisions after an ECAST event are complex and beyond the scope of this video. Such issues are best discussed with an appropriate specialty care consultant. Respond with knowledge, proper protocol, and confidence. To help providers in treating an exertional collapse associated with sickle cell trait event, please download the ECAST treatment protocol from the CHAMP website, www.usuhs.edu/champ-provider.